This is part 2 of Chapter 3, Nutrition 230, Digestion and Absorption. We just finished by talking about the cephalic phase and the mouth. Once the food goes from the mouth and is swallowed into the pharynx and then into the esophagus, we call it a bolus of food. So a bolus of food is the mixture of saliva and an partially digested food. So before swallowing, the pathway to the lungs is open. During swallowing, the bolus of the food forces the epiglottis down, which covers the passageway to the lungs, or the trachea. Then, after swallowing, the epiglottis returns to its original position, and the airway to the lungs is reopened. If somebody inhales their food rather than swallows their food, there's a danger of the epiglottis not covering the trachea, which could cause the bolus of food to go down the trachea, thus causing somebody to choke. The Heimlich maneuver puts pressure on the lungs, which then squeezes air, forcing that bolus of food back out of the trachea and out of the mouth. In the esophagus, circular muscles contract, pushing the bolus down. Longitudinal muscles contract, shortening the passageway ahead of the bolus. This is called peristalsis. So the muscular contractions are called peristalsis, squeezing that food bolus down from the esophagus into the stomach. Once the bolus of food hits the gastroesophageal sphincter, it opens that gastroesophageal sphincter and the bolus of food travels into the stomach. Then the gastroesophageal sphincter closes again, and this causes the acidic contents of the stomach to stay in the stomach. The stomach is made of 3 muscular layers: longitudinal muscles, circular muscles, and diagonal muscles. These different muscles allow the sloshing to take place in the stomach, so the bolus of food can really mix with gastric juices. The food, once it's mixed with gastric juices, is now called chyme, C-H-Y-M-E, rather than a bolus. When we look a little closer at the structure of the stomach, the mucus cells, parietal glands, chief cells, they all secrete mucus, and then hydrochloric acid and pepsinogen into the lumen of the stomach. So with the mucus, the HCl, and the pepsinogen, we're able to mix food and digest food, and then also prevent immune system dysfunction as well, so we can really prevent foreign invaders from getting into the body. The small intestines are made of, as I mentioned before, villi and microvilli, which cover the lumen of the small intestines. These villi look like finger-like projections, and then they have these microvilli, which are hair-like projections on them. On each villi is a mucosal cell. Those mucosal cells are going to cause absorbed food to either transfer into a lacteal and then to the lymph vessel, or into a capillary and then into a venule and then into a vein and then to the portal vein to the liver, depending on whether or not the digested food is either fat soluble, in which case it would go through the lymph, or if it's water soluble, in which case it would go through the vein to the portal vein to the liver. Segmentation is, I like to think of it as looking almost like a little inchworm, like a little gardener worm. It is the squeezing and contracting of the smooth muscles that allows the food to keep traveling through the small intestines. We don't, of course, need to voluntarily do this, so the smooth muscles are going to be involuntary contractions, just responding to the presence of that bolus of food and the hormones that we talked about before, like CCK and ghrelin and gastrin in the stomach and in the small intestines. When we look at the brain and digestive system connection is very strong. So before food enters the stomach, in that cephalic phase, the brain is going to send nerve signals that stimulate gastric secretions, such as gastrin, to increase motility. Food enters the stomach and increases the rate of gastric secretion and motility by stimulating nerves and then sending signals to the brain. Food leaving the stomach is then going to distend the intestine and triggers other hormonal and nervous signals that decrease stomach motility and slow the secretion of gastric juices. So just by the presence of food in different parts of the GI tract, different hormones are responding in the brain in order to decrease and increase the motility of different parts of the GI tract. So as we mentioned before, the accessory organs include the gallbladder, liver, and pancreas. The gallbladder stores bile, and the pancreas secretes digestive enzymes and bicarbonate ions into the small intestine. So anything that's being secreted by the pancreas is actually happening in the small intestines. And then the liver makes the bile. Digestion nutrient breakdown. So when we look at the breakdown of sugars, starches, and fiber, polypeptides or proteins, and then large lipid droplets, we need to bring those through enzyme action, chemical reactions, to small enough pieces to be absorbed either into a venule and vein and then go to the liver or into the lymph. So all sugars and starches are digested into single sugars, which then head to the portal vein into the liver. Similar with amino acids, all polypeptides are digested into amino acids that head to the liver. And then large lipid droplets are digested into either short-chain fatty acids, which can fit into the venule and vein and go to the liver, or long-chain fatty acids, which have to be incorporated into lipoproteins that then head to the lymph and are deposited into the bloodstream a little bit later. When we look at nutrient absorption, there are 4 different methods of absorption. There's simple diffusion, where fatty acids go from an area of higher to lower concentration. Osmosis, which is kind of like simple diffusion, but for water, from an area of higher to lower concentration. Facilitated diffusion, which brings molecules such as fructose from an area of higher to lower concentration, but requires a protein molecule. And then active transport, which brings molecules from an area of lower concentration to higher concentration by requiring energy. The large intestine can absorb water and some vitamins and minerals, but most digestion and absorption is going to take place in the small intestines. The intestinal microflora are produced here, and the large intestines contain the colon and the rectum. We have the ascending, transverse, descending, and sigmoid colon. Water, nutrients, and fecal matter can spend up to 24 hours in the large intestines. We can maintain health of the large intestines by eating probiotics, which feed our healthy bacteria. We want to make sure that we have a balance of healthy bacteria and less unhealthy bacteria. So prebiotics and probiotics, which can either be taken in by foods such as yogurt. You might have certain yogurts that are fortified with extra probiotics, such as Activia or Yo Plus Digestive. And then you can also take a pill form of probiotics. There are also other products such as kombucha and fermented products that naturally contain a good amount of probiotics as well. The GI tract plays an important role in protecting the body from infection, as I mentioned before. We have a lot of phagocytes, lymphocytes, and antibodies in the GI tract that are really going to help protect our bodies from having any foreign invaders enter. Remember, the hollow tube of the GI tract is actually outside of the body, so the foreign invaders that go through the GI tract and are eliminated in the feces, they never actually entered our body because they weren't absorbed. Now, when we look at the GI tract, there are a number of common digestive problems that occur that we can treat through medication, through different foods, and through meal patterns. So dry mouth can be caused by disease and medications. Consequences can cause decrease in food intake, increase in tooth decay, and gum disease. We can treat it by changing medications or using artificial saliva or even specialized products that are a little bit easier to swallow. Dental pain and loss of teeth can happen due to tooth decay and gum disease. This can also cause reduced food intake and decreased nutrient absorption and incomplete digestion. So a change in consistency of food consumed might be appropriate. Heartburn, which if it happens over and over again, is called GERD or gastroesophageal reflux disease. This is caused by the stomach acid leaking through the gastroesophageal sphincter back up into the esophagus. This can cause pain and discomfort after eating, ulcers, and increased risk of esophageal cancer. There are a number of steps you can take to accommodate GERD, including reduced meal size, high-fat food avoidance, consuming liquids between rather than with meals to decrease the overall volume, remaining upright after eating to promote the food traveling down into the stomach, and then taking antacids and other medications can help as well. Hiatal hernias are another common problem. This is caused by pressure on the abdomen from severe coughing, vomiting, pregnancy, straining while defecating, or it can be common in weightlifters and other people who are lifting heavy objects. Consequences can cause heartburn, belching, GERD, and chest pain. Again, a lot of the similar things to heartburn you can do in terms of treatment and management of hiatal hernias. We have some other issues as well. There's ulcers, which happen often in the stomach by the bacteria H. pylori, and that damages the epithelial lining. Can happen because of chronic use of drugs such as aspirin and ibuprofen that erode the mucosa, or can be a consequence of GERD. It can cause pain, bleeding, and abdominal infection. Antibiotics can be used to treat the infection, and then antacids can be used to reduce acid and reduce the pain. Vomiting could be caused by bacterial and viral infections and medications, other illnesses, eating disorders, pregnancy, and food allergies. These can lead to dehydration and electrolyte imbalance and can damage the mouth, gums, esophagus, and teeth. Patients can take medications to treat the infection and replace fluids and electrolytes as well. Diarrhea has similar consequences to vomiting because you're eliminating a lot of fluids, but through the other end in terms of feces. And medications to treat these can be fluid and electrolyte replacement, as well as medications to treat infection. Constipation, of course, is the opposite of diarrhea and can happen due to low fiber intake, low fluid intake, and then also combination of high fiber intake and low fluid intake, and can be occurring due to weak intestinal muscle. So often you'll see this happen when people increase fiber really quickly. This can cause intestinal blockages, formations of pouching in the intestinal wall called diverticula, which then, if not treated, can lead to diverticulitis. So having a high fiber plus high fluid diet, exercising to increase motility can be helpful, and then medications can be helpful as well. Irritable bowel syndrome is used to describe a number of different factors that might lead to an unusual pattern of muscle contractions in the intestines, and they might be stronger and last longer, or slower and weaker than normal. The common symptoms include bloating, gas, diarrhea, and constipation. It seems that stress management, changes in diet and lifestyle, recently the FODMAPs diet has been really helpful in helping IBS, fiber supplements, antidiarrheal medications, and other medications can be helpful. In addition, pancreatic diseases, such as caused by cystic fibrosis or pancreatitis, can cause a lot of malabsorption. So oral supplements of digestive enzymes might be necessary. And then gallstones, which are deposits of cholesterol, bile pigments, and calcium in the gallbladder or bile duct, can cause severe pain and poor fat digestion, which can be accommodated by a low-fat diet, but might need surgical removal of the gallbladder if left untreated for too long. A lot of people use antacids in order to prevent GERD and heartburn. It's really important to take a look at your antacids and make sure that you're not consuming too much calcium and too much magnesium when you're consuming these antacids, because those are minerals that do have ULs or tolerable upper limits. And as well, you do need to take a look at what the inactive ingredients of antacids and other medications might be. So if you have a sensitivity to corn, for example, or to lactose, then this specific antacid wouldn't be for you.